Chairman Coons, Ranking Member Flake, and other distinguished members of the subcommittee. On behalf of IntraHealth International, thank you for inviting me to testify today on this issue of paramount importance to our friends in West Africa and to us here in the United States. I ask my full written testimony be submitted for the record.
Without objection.
In my native Senegal, there is a Wolof proverb, nit nitay garabam. It means the best medicine for a person is another person. I'm fortunate to lead an organization, IntraHealth International, that for 35 years has been a first-hand witness to this proverb in action through our support to frontline health workers in 100 countries around the world, including all the Ebola-affected countries. Tragically, however, far too many people in the West Africa region I hold dear did not have access to that person, that health worker, who could have prevented Ebola from desolating their communities and threatening the well-being and security of their countries, their region, and the world. As this Ebola outbreak has already started to fade from the consciousness of some, one of the crucial underlying conditions that help the virus spread remains the lack of sustainable and resilient global health workforce. Let there be no misunderstanding. If health workforce does not get the high-level political attention it sorely needs, workforce deficiencies will continue to threaten global health security, and the tremendous progress made in saving women's and children's lives and fighting diseases like HIV/AIDS, and all the great work accomplished by the USAID will fade. Liberia, Sierra Leone, and Guinea all had fewer than 3 doctors, nurses, and midwives, as recently shared by the President. 3 doctors, nurses, and midwives per 10,000 people, even before the Ebola epidemic began. But these countries are hardly alone. The World Health Organization last year estimated that 83 countries in the world are below the minimum threshold needed to provide essential services to everyone. Last year, at a major conference in Brazil, Guinea and Liberia were among 57 countries that made health workforce commitments. Guinea's commitment highlighted 2 rural provinces where frontline health workers were largely absent. And one of those regions is where patient 0 of Ebola epidemic was believed to be infected less than a month later. Let me be clear. Because of the generosity of the American people and the know-how and innovations of implementing partners like IntraHealth, the United States government has maintained the leadership for global health. And no one on this earth will dispute that the mantle of that leadership rests and will continue to rest on the shoulder of the United States. For example, IntraHealth and UNICEF are currently working with the Liberian government on a tool called mHero to allow the Ministry of Health and health workers to instantly communicate critical information. The USAID supported open source online personnel management system is being used called IRIS and will save low-income countries about $232 million, and its data have been used to drive additional domestic investment for health workers. IRIS is expected to save the Liberian government in the next 5 years the equivalent of salaries of 317 Liberian nurses who could serve 634,000 Liberians. These innovations, supported by the American Foreign Assistance, are critical to addressing some workforce challenges, but certainly not all of them. The Frontline Health Worker Coalition, an alliance of 41 US-based public and private organizations, with the Secretariat housed in our offices at IntraHealth, last month released recommendations for how the U.S. can lead on these issues. I've included them in an addendum to my testimony. In brief, there must be a more concerted effort to address the needs of local health workers in West Africa, such as ensuring timely delivery of hazard pay and personal protective equipment. This support to local health workers must be backed by an equally fervent political push for addressing the most critical gaps globally. A 2010 report estimated that by 2020, the U.S. needs to invest at least $5.5 billion in health work strengthening to achieve its global health goals. Investment must be guided by a cross-agency strategy that sends an unequivocal message that America is committed to this issue, and we expect others to respond in kind. I also believe all global health procurement should be required to show how they will help strengthen the health work system. I'd like to close by asking each of us to think about what it would be like to wake up tomorrow morning infected with Ebola and not have a single person in your community to turn to for care, or to have your infant child this evening show signs of malaria and have nowhere to take her. This is a reality for far too many, and it must be changed now. We would be doing a great disservice to the 348 health workers who have given their lives to help turn the tide on this Ebola epidemic if we didn't focus on their colleagues' immediate needs while working fervently to ensure we never again have a crisis of this scale in public health. I thank you very much, and I look forward to answering your questions.
Thank you.